There is one habit that quietly outperforms almost everything else in the world of preventive health. It requires no equipment, no subscription, no special clothing, and no coach. It has been studied in populations numbering in the hundreds of thousands. And yet, despite the extraordinary weight of evidence behind it, most people still treat it as a last resort, something you do when you can't manage anything more demanding. That habit is walking. And what the research actually shows about what happens inside your body when you walk consistently every single day will genuinely surprise you. My name is Dr. Marcus, and I've spent the better part of 9 years working in emergency and acute care medicine. During that time, I've seen the entire spectrum of what the human body looks like when it's been cared for and what it looks like when it hasn't. And one pattern has stood out to me more clearly than almost any other. The patients who are still moving regularly as they grow older, who still walk their neighborhoods, still climb their stairs, still cover ground on their own 2 feet. Those patients recover faster after illness, experience fewer serious complications, and hold on to their independence far longer than those who stopped moving years earlier. Movement is not just exercise. It is one of the most reliable predictors of how well a human body ages and how long it keeps going. About 14 months ago, my family adopted a young golden retriever named Biscuit. He came home as a small, clumsy, oversized puppy, and as he grew, so did his appetite for distance. Within a few months, we were walking 3 times a day, morning, midday, and evening, across a hilly part of town that doesn't let you off easy. And I started noticing things about myself that I wasn't expecting. My baseline fitness improved noticeably. My legs became stronger. My mood stabilized in a way that was genuinely striking. Not a subtle shift, but a real and consistent change in how I felt day to day. My appetite became more regulated, and my craving for high-sugar foods, which had always been a persistent issue for me personally, became significantly easier to manage. I'm sharing that because when I tell you the research on walking is compelling, I'm not speaking from a distance. I've felt it myself, and it matched the science in ways I couldn't ignore. So let's go through what consistent daily walking actually does inside your body, systematically and in real depth, because the list is longer and more impressive than most people realize. The most well-established benefit is what walking does to your heart. A large-scale analysis drawing on data from over 400,000 individuals found that regular walking was meaningfully associated with reduced cardiovascular mortality. The relationship between steps and risk was clearly dose-dependent, meaning more walking correlated with better outcomes, with the most significant gains occurring somewhere between 7 and 10,000 steps per day before the curve began to level off. Physiologically, walking improves the function of the inner lining of your blood vessels, reduces arterial stiffness, lowers resting blood pressure, improves your cholesterol and fat profile, and reduces the background inflammation that quietly accelerates cardiovascular disease. One major long-running study that followed over 70,000 women for 8 years found that those who walked briskly for at least 3 hours each week had a 35% lower risk of heart attack compared to those who were largely sedentary. 35% from walking. Closely tied to heart health is what walking does to blood pressure specifically, and this deserves its own attention. High blood pressure is among the most common conditions I encounter clinically. A significant proportion of patients who come through the door are already in a range that places them at serious risk, often without knowing it. Hypertension damages blood vessels gradually and silently over years, and it is one of the primary drivers of stroke, heart attack, and kidney disease. Research published in a major hypertension journal found that structured walking programs produced average reductions of around 3 to 4 millimeters of mercury in systolic blood pressure, the top number in a reading. That may sound modest, but in population-level terms, a 3-point reduction in average systolic pressure corresponds to substantially lower rates of stroke and cardiac events. For individuals in the earlier stages of high blood pressure, that kind of reduction achieved through lifestyle alone can be enough to delay or even avoid the need for medication. Walking also transforms how your body manages blood sugar, and the mechanism here is particularly interesting. When your leg muscles contract during walking, they pull glucose out of the bloodstream through a pathway that operates partly independently of insulin. This means that even in people whose insulin signaling is impaired, those who are insulin resistant, pre-diabetic, or managing type 2 diabetes, muscle movement itself can drive glucose into the cells that need it. One well-known study found that 3 short walks of 15 minutes each, taken after meals, reduced overall blood glucose levels across 24 hours more effectively than a single 45-minute session taken at a random point in the day. The timing matters. A brief walk after eating is one of the simplest and most powerful tools available for glucose management, and it costs nothing. Lower post-meal glucose means lower average insulin, less damage to blood vessel walls through a process called glycation, and over time, a real reduction in the metabolic foundations of chronic disease. Your kidneys benefit significantly as well. A study that tracked over 6,000 individuals with chronic kidney disease found that those who walked regularly experienced meaningfully slower progression toward kidney failure compared to those who remained sedentary, even after accounting for other health variables. The mechanisms are largely indirect, but well established. Walking lowers blood pressure, which reduces the physical strain placed on the tiny filtering structures inside the kidneys. It improves insulin sensitivity and reduces blood sugar, both of which are direct drivers of kidney damage when elevated over time. And it reduces systemic inflammation, which is an independent contributor to kidney disease progression. The kidney benefits of walking flow through these pathways reliably and consistently across multiple lines of research. The liver is next, and this is an area where the evidence is genuinely striking. Non-alcoholic fatty liver disease has become one of the most common chronic conditions in the world, affecting an estimated 1 in 4 adults. Most people who have it are completely unaware of it because in its early stages it produces no symptoms at all. Over time, however, fat accumulation in the liver can progress to inflammation, then to scarring, and in some cases to cirrhosis or liver failure. Regular aerobic movement, including moderate-intensity walking, has been shown to directly address this condition. A systematic review published in a leading hepatology journal found that exercise programs, including walking, significantly reduce the amount of fat stored in the liver. And crucially, this effect occurred even in participants who didn't lose meaningful amounts of weight. That point is important. The liver benefit is not simply a byproduct of getting thinner. Walking increases the rate at which the liver burns fatty acids for fuel, reduces the flow of free fatty acid from fat tissue into the liver in the first place, and improves insulin sensitivity, which in turn reduces the signaling that drives fat accumulation to begin with. The movement itself is doing metabolic work at the cellular level. Joint health is an area where most people carry a significant misconception. The common assumption is that walking wears joints down, that if your knees are already struggling, you should rest them. The evidence points in the opposite direction. Cartilage, the cushioning tissue inside your joints, has no direct blood supply. The only way it receives nutrients is through the movement of fluid within the joint, and that fluid only circulates when the joint moves. Joints that stop moving regularly become less nourished, stiffer, and more prone to break down over time. A large longitudinal study tracking thousands of people with or at risk of knee arthritis found that those who walked regularly reported less pain and retained better function over time compared to those who didn't. Walking also builds the muscles surrounding the joints, the quadriceps, gluteal muscles, and hip stabilizers, and stronger surrounding muscle means reduced mechanical load passing directly through the joint itself. The muscles act as natural shock absorbers, and building them through walking actively protects the joint over the long term. On the subject of muscle, as we age, we naturally lose lean muscle mass through a process called sarcopenia. It is one of the primary reasons people become frail in later life, lose their balance, fall, and lose their independence. Walking is not a replacement for resistance training if building muscle is the goal. But for preserving the muscle you already have, maintaining coordination, and slowing age-related decline, the evidence is clear. A study published in a major clinical nutrition journal found that people who walked more each day retained significantly more lean muscle mass over a 4-year follow-up period than those who were less active. Part of this is metabolic. Walking improves insulin sensitivity, which plays a role in muscle maintenance. And part of it is neuromuscular. Keeping your legs moving regularly preserves the communication between brain and muscle that governs balance and coordination, which becomes increasingly critical as the years accumulate. Perhaps the most personally felt benefit, and the one I can speak to most directly from my own experience, is what walking does to mental health and cognitive function. The evidence in this area is extensive and consistent. Walking reduces depression, reduces anxiety, stabilizes mood, and lowers circulating levels of cortisol, the body's primary stress hormone. An analysis spanning multiple large studies and populations found significant reductions in depression scores as a direct result of regular walking. The biochemical reasons are well understood. Walking promotes the release of endorphins and endocannabinoids, which are the brain's natural mood-regulating compounds. But beyond mood, walking also raises levels of a compound called brain-derived neurotrophic factor, which functions like a growth signal for brain cells. It supports the survival of existing neurons and encourages the formation of new ones. Higher levels of this compound are consistently associated with better memory, sharper cognitive function, and meaningfully lower rates of dementia. One of the longest-running cardiovascular and health cohort studies in history found that people who remained more physically active over time had substantially lower rates of dementia in later life. These are not soft findings. They represent decades of data pointing in the same direction. When you combine all of those effects together, the improvements in heart function, blood pressure, glucose regulation, kidney resilience, liver metabolism, joint preservation, muscle retention, and brain health, the cumulative impact on lifespan becomes profound. A study tracking nearly 5,000 older women found that those walking approximately 7,500 steps per day had dramatically lower rates of death from all causes compared to those averaging around 2,500. And the protective benefit appeared to plateau near that 7,000 to 8,000 step mark, which carries a practical message worth holding on to. You do not need to chase extreme step counts. 7,000 to 8,000 steps per day, done consistently, delivers the overwhelming majority of the benefits the research supports. The question then becomes how to actually make this happen in real life, because understanding the benefits has never been enough on its own to change behavior. Start by finding out where you currently stand. Most smartphones track daily step counts passively in the background. Pull up your average from the past week and use that number as your honest baseline. If you don't have that data, an inexpensive fitness tracker, widely available for well under $30 or 20 pounds, will give you what you need within a day or two. If your current average is below 3,000 steps, the only objective for the next 2 weeks is to add one short walk of 10 to 15 minutes per day. That is the entire goal, nothing more. Evidence consistently shows that starting small and layering gradually is far more effective for building lasting habits than dramatic initial efforts that burn out within days. After 2 weeks, that walk will begin to feel normal, embedded in your routine rather than added to it. At that point, introduce a second walk. And if you can time at least one of those walks for shortly after a meal, even 10 minutes of post-meal movement will have a measurable impact on your blood glucose response. For most people, the target worth working toward is somewhere between 7,000 and 8,000 steps per day. The exact number will vary depending on body size, terrain, and age, but that range represents the point at which research shows the benefits are most clearly realized. As for pace, the goal is to move briskly enough that conversation is comfortable, but sustained singing would be a challenge. A light breathlessness, enough to notice, but not enough to interrupt speech. That is the metabolic and cardiovascular sweet spot. And finally, the most important variable of all, consistency. A single good walk changes very little. 6 weeks of daily walking begins to change the structure and function of your body in ways that are measurable and meaningful. Make it as frictionless as possible. Same time each day if you can. A route you genuinely enjoy. A companion if that helps you show up. The habit, built quietly and maintained steadily, is the intervention. Everything else is just detail.